My name's Sara Lightowlers. I'm a doctor training in clinical oncology, and as part of my training, I recently completed a clinical PhD fellowship at the Cancer Research UK Cambridge Institute. I'm currently working as a clinical sustainability fellow at the Cambridgeshire and Peterborough Integrated Care Board, the organisation that commissions healthcare in the region. My PhD research focused on breast cancer radiotherapy. I wanted to understand more about the biology of how breast cancers respond to this treatment, and also about the patterns of recurrence of breast cancers following radiotherapy. One of the big pieces of work involved was looking at cancers from two large breast cancer radiotherapy trials. I looked at the genetics of these pairs of tumours, which can help us to understand whether the two are related, as in whether the second is a recurrence of the first cancer, or whether it's actually unrelated, so a new primary tumour that's occurred in that patient by chance. The team also used computer-aided analysis of CT scans to help us understand where in the breast those two different types of tumour occurred. And if we could reliably identify those two different things in the clinic, tell one from the other, that would really help us be able to tailor breast cancer treatment to that individual woman and her cancer, and hopefully help people who don't need it avoid really intensive treatment. I'm working as a sustainability fellow at the Cambridgeshire and Peterborough Integrated Care Board, and this means I'm working to make healthcare in the region more environmentally sustainable. And this is something that all NHS trusts and integrated care boards have a legal obligation to do. Most of my work this year has been focused on operating theatres, which are a really resource-intensive part of a hospital. This means that there are lots of greenhouse gases released as a result of surgical operations. The good news is there are lots of things that the NHS is doing to improve this, and these also often mean a better patient experience and sometimes cost savings too. So we know that climate change and other environmental problems are bad for cancer patients, as well as leading to higher chances of some types of cancer. They can disrupt the healthcare systems that people need for quick diagnosis and treatment. So we need to play our part in helping to stop this by making cancer care more sustainable, which often means making it more efficient and less wasteful. So what I want to do in the future is to combine my PhD experience and my sustainability work to research ways in which we can make breast cancer care more sustainable like this, as well as more tailored to individual patients and a better experience.